When an unknown virus hits, treating patients is one of the most challenging tasks because there's no experience or treating method available. With Wuhan being the first epicenter, here I'd like to focus on the treating method and the health strategy that China took to treat the COVID-19 patients. First, best medical resources were sent to treat critically ill. A respiratory doctor with almost 30 years of experience treating critical conditions said COVID-19 is one of the most vicious viruses that he had ever met.
新冠病毒确实很厉害，它不但打击肺，它会打击你心脏，打击你消化道，打击你肾脏，打击你凝血。而最重要，除了打击肺以外，最重要的系统是打击你的免疫系统，快速打击。
So when Wuhan was on lockdown, China's top experts in respiratory diseases, epidemiology, and critical care medicines from across the country were sent to help. That helped pull Wuhan's medical system back from the verge of collapsing. Meanwhile, doctors kept writing and updating 7 versions of diagnosis and treating schemes, which are now available in English and being shared around the world. To treat the most critically ill, China built 2 brand new hospitals, Huoshenshan and Leishanshan, within 2 weeks. Several hospitals in Wuhan were also transformed into the ones that only treat COVID-19 patients, increasing hospital beds from 1,000 to 9,000. Nationwide, almost 10,000 hospitals were designated to specifically treat COVID-19 patients. But what happened to mildly ill patients? Among all cases in Wuhan, 80% were mildly ill. Early intervention was a crucial step to prevent them from turning into critically ill. But how do you treat mildly ill without taking hospital beds from critically ill? Well, China kept building more medical facilities. In February, Wuhan transformed public venues and built 16 makeshift hospitals, providing 30,000 more beds in Wuhan. All medically ill patients will be sent to such hospitals rather than staying at home. And this move also stopped the virus from further spreading in the communities. A thorough analysis about such kind of hospitals is available on the Lancet. But there's another one that is also very important. All costs related to COVID-19 were covered by the government. No matter what your origin or social background was, if you contracted the coronavirus, or you were a suspected patient, or you're just a close contact of such patients, all costs were covered by the government. That includes medical treatment, meals, and accommodation. Everyone could go to the hospital without worrying about financial burdens. For critically ill patients, sometimes the bill could go to $10,000 a day. By April, China has spent $21.4 billion in controlled epidemic. These are some of the patients admitted in hospitals. You could see how optimistic they were when they started to get better and better. The amount of money, effort, and manpower that China put into treating patients was tremendous. But it was worth it because they saved countless people and their families. Throughout the entire pandemic, the #1 priority of China was always saving lives.